This video describes the packing process of umbilical cord blood and tissue for stem cell banking once the sample has been collected. How to pack the collection. Number 1. Stick the blue client registration sticker onto the blood bag. If you cannot find the blue blood bag sticker, please stick one of the patient's hospital stickers onto the blood bag. Number 2. Ensure the needle covers are securely placed, clamps are closed, and one secure knot is tied in the tubing. This is very important to ensure the blood bag does not leak. Place the blood bag with the absorbent cloth between the white gel pack and then place both the blood bag and the gel pack into the clear bag provided and ensure that it is properly sealed. This is very important to ensure that there are no leaks in the kit. The gel pack regulates the temperature and it is therefore safe for the kit to remain at room temperature until the courier or driver arrives to collect it. Number 3. Place the packaged blood bag into the foil bag and ensure that the checklist on the foil bag sticker has been completed. Number 4. If the cord tissue has been collected, the collection date and time must be recorded on the yellow sticker provided. Number 5. Place the cord tissue tube in the foil bag along with the packaged blood bag. Number 6. After the maternal blood test samples have been drawn, place the 4 filled test tubes into the clear packet marked maternal blood collection. Number 7. The date and time of collection must be recorded on the red sticker provided. Number 8. Place this packet in the silver foil bag. Number 9. Place the foil bag into the collection kit box. Number 10. Ensure all documents are filled in and signed. The documents must be placed in the collection kit box. It is imperative that the gynecologist or midwife has completed the birth ID form. Number 11. Please ensure that the box is placed inside the plastic courier bag. Number 12. The patient is then required to call the Netcells Client Services team on 084 664 4646 to arrange the collection of the kit. Please note, the cells remain viable for 72 hours and we endeavour to get them to our laboratory within 24 hours. The collection kit must always be kept with the patient and must not be left with any staff or in theatre. Congratulations on taking the steps to secure your baby's future health by banking their stem cells, and welcome to the Netcells family.